Hi there, I'm Lisa from the White Pigeon Township Library. I'm here with Maddie, and we are at the Muscle Therapy Acupuncture Center in White Pigeon. And I'm here with Tina Schumacher, and she's going to tell us a little bit about what they do here.
Thank you. Welcome,
Thank you for having
Lisa.
us.
Thanks, Maddie, for coming over. Yeah, I'd be glad to tell you about our services and kind of some of the things that we do here. Mainly acupuncture services, massage therapy, craniosacral therapy, and there's a chiropractor that operates out of this location 3 days a week. And so there are also chiropractic services. So it's an umbrella where a person may come for more than one service. That often happens if we treat a lot of pain and dysfunction and neurological conditions, allergies. We help a lot of people quit smoking. And that particular treatment is 85% effective. So, you know, some treatments are immediate in their results. So we're excited about that. Help a lot of people quit smoking.
Fantastic. So can you tell me how you got started with acupuncture?
Sure. So in 1985, I became a sports massage therapist, and I did that for a number of years, and then I became interested in acupuncture. One of my patients was coming in for massage therapy on a regular basis, and she did a number of acupuncture treatments, made a big change in her body, and it really got me excited about it. And then I decided to go back to school and add that to what I'm doing. So I went back to school when my son was going to kindergarten. And here I am doing acupuncture, licensed acupuncturist for 22 years at this location. But this is an exciting year. This is 35 years in business for me this year.
Fantastic.
Yeah.
I'm glad to be here. I've always been curious about acupuncture. I drove by, and I'm just glad to be here. So let's get started.
Okay.
All right.
All right. Thank you.
Okay, we're here in a treatment room with Tina at the acupuncture center. So Tina, tell me about what we have here.
Okay. So what we're looking at is some different acupuncture needles. They come in all different lengths and diameters. Some of the different colored handles help denote the diameter. So some of these that are red in color are very fine. So they are used for like sinus treatments, facial treatments, points in the ear. Then we get into some like this that are just a hair thicker, and those are body points. If someone came in for back pain, neck pain, this would be common. Now, the difference between them is slight, but the different colors that you see there are, you're looking at different diameters of needle. And then if we're talking about how small and fine they are, I'll get one out. We can just look at it. You know, when you go to the doctor and you get a shot, it's a hollow needle, right? Because something's being administered. These are solid stainless steel shaft. So you can see it's like a hairbreadth.
It's tiny. You can barely see it. I don't know if you can see it on camera, but
I don't know if we put it behind a darker background, if that helps. And so you can place 3 of these inside of one hypodermic needle just to give you some idea about how fine they are.
Wow.
Okay? So because of that, that's one reason you don't feel it so much. Okay. Very fine, and so what most people feel is just a slight tap on the skin. Comes with a guide tube. That's a 1/16 of an inch difference than the length of the needle, and so it can be tapped into the skin very quickly. And all the sensation is right up on that top layer, so it doesn't really matter what depth it goes. Once it's tapped in, you just don't feel it.
Okay.
Okay? So, as I said, all the needles are sterile. They come packaged like this. They're used once, and then after, they're put into a biohazard because that's medical waste. None of it is re-sterilized or reused, so that's standard. In Michigan, the requirement is licensure for acupuncture. You have to have gone to a nationally certified school, passed a board exam, and the last few years, acupuncturists were all registered with the state, and just recently they passed licensing, so that will be totally regulated through the state at this point. Michigan was one of the last states to do that.
Very good.
Yeah.
So tell me a little bit about what a typical treatment looks like when somebody comes in.
Well, a person comes in and we go over their history. We go over everything that's led up to that point, whether they're coming for pain, maybe they have an MRI from their doctor. So we take in all the information, we do a physical exam, and then once we decide on our strategy, a course of treatment is often 4 to 6 treatments.
Okay.
So a person might come once a week, 4 to 6 weeks, and many times something chronic will have changed, or you can reduce inflammation and muscle tension. So that's typically how it's done. A person will come once a week or maybe twice a week.
Do you have anything that's like an ongoing treatment, like once a month for people to manage pain?
Right.
Chronic?
So that's kind of maintenance. So some people will, once they get out of, they do that initial series and they get out of pain or their symptoms have resolved, a lot of times what we'll do is taper them off and they'll do a maintenance. And some people just choose to keep that up and they come once a month or every 6 weeks. Or sometimes if their pain has resolved, they might even come at the change of the season. Or if they, do something short term that bothers them, like they've done leaves or they've done some physical activity, or maybe with arthritis they've had a weather change and then they're having pain and they need a treatment. So yes, we do see people again and again, but usually things are resolved within a series at the beginning, and then they can do maintenance as is.
Okay.
As needed. So what we could do, if you'd like, is a demonstration where you could feel one of these points.
Sure.
And there's a point that's on the hand that we can do that is typically what we call control point for head and neck pain. So anything from here up that's bothering a person, whether it be sinus or maybe they have a migraine headache, we'll demonstrate a very common point that we do for that, if that's okay.
For sure. And where do you normally, is there certain locations? Is it all over the body that you treat, or is there certain areas of the body?
Well, with acupuncture, you have lines of energy, or we call them meridians,
Okay.
that govern different areas. And so it depends on what the person's coming in for as to where we would put the points. But just to give you an example, let's say you came in with some back pain. Those meridians end in your feet, so in order to get your back to release, we would end up doing some behind the knee and at the ankle.
Okay.
If you came in and you needed a sinus treatment today, you might have some local points up here in the sinus region, but some of these down on the arm and wrist are just as important because it ties it all together.
Okay.
All right?
Fantastic. So we're going to give a little demonstration here on me,
Mm-hmm.
on my hand. So I've never done this before. I'm excited. I'm not really nervous. These needles are very, very tiny. So we'll get started.
Okay. Points that are done on the body are wiped off with alcohol.
Okay.
And we'll just let that dry for a minute. And then we'll do this point, as I said, it's a kind of a control point for head and neck.
Okay.
If you had a toothache today, this would be an excellent point.
Barely felt that. I don't feel it at all.
Yeah, and then really that's how it is most of the time. Unless a person takes a peek at where the points are on their body, they're not aware of them. So it's not a painful process. Common treatment, you might have 10 or 12 points like that in different areas. A course of treatment is we'd leave it in about 25 minutes. It takes about that long to balance. And then at the end of that treatment, the point is removed, which I'll do in just a minute here, and it's put into a biohazard. But most people just don't feel it. What will happen when the points are in, it makes you a little bit relaxed, tired. A lot of people fall asleep during treatment. Your body releases different chemicals at the site, and it makes you feel kind of calm. One of the neurotransmitters is serotonin, so it's kind of that feel good that you get, like a runner's high. I mean, you definitely feel relaxed with the treatment and very calm. And so most people fall asleep during that 25 minutes.
And how long, once they go home, does that last?
Well, after the needles are taken out, that the chemical release stops at that point. But what happens is for about 24 hours, all the meridians are balancing. So usually when a person starts treatment, whether they're coming for pain or some kind of dysfunction, they often notice their energy picks up or they sleep a little better. You can notice other things that are happening that are ongoing from the treatment. So that's always exciting too when you see other changes as well, because it helps the body balance and heal. So I should say too, this is drug-free approach. So on the needle, there's no medicine.
Okay.
It's just a stainless steel shaft, but it's going into a point that's based on research. You know, if we picked a point that doesn't have anything to do with acupuncture, it's not going to make any change in your body at all. But the points are in specific locations. And so if we can stimulate them, then you get the release of chemicals. It acts as an anti-inflammatory. It'll get energy moving throughout your body and make some changes. And it helps a person balance. So a lot of people, for instance, after surgery, let's say knee surgery, so many times hip surgery, knee surgery, the person is trying to heal, and that scar tissue sometimes can be so tight and it's hard to get it moving. So we help a lot of people after surgery using needles like this. We treat their scars, it softens up and they heal quicker, and their body is healing itself. You're just helping the body do its natural process.
So if somebody's having trouble quitting smoking, how does that help?
So thanks for asking. That's a great question. So the quit smoking treatment is 2 treatments.
Okay.
They come in the evening and then again the next morning. The 2 appointments are about 12 to 18 hours apart. This is one of the points that we use for that treatment. They have hands, feet, and there's a couple in the ear. Okay. For that treatment, the ones in the ear are hooked up to an electrical device like this. And so you have these little clips on the points of the ear. You're stimulating points that are helping them with that addiction. And you might think, well, how could that work? So nicotine's much like our own neurotransmitters that we make. So when a person's smoking, their body will use that constant input of nicotine for certain processes. And then all of a sudden when they quit and they don't have the nicotine anymore, guess what? Their body has to start making chemicals, and we can ramp up that production with a treatment so that in a half hour, that's how long it takes to do the treatment, when they walk out the door, their body's producing these neurotransmitters again. And so what happens with that? They don't have near the withdrawal. They don't crave it nearly as much. If they went cold turkey, it might take 8 or 10 days for their body to ramp up that same level of neurotransmitters. But with the treatment, it happens immediately. So they still have to want to quit. Right. You know, they have to have their mind in the right place, but it makes it easier, and it's not as uncomfortable for them. Now they come back the next morning, they repeat the treatment, and that's all they need are just the 2 treatments to quit smoking. And for most people, that's fine. Once in a while we'll get a chain smoker, or we'll get someone who gets up and they smoke through the night. Well, a person like that has a little more nicotine in their body, and so then we often need a 3rd treatment. But it works very well if a person's ready. Like always, you have to want to quit, you know.
Well, that's good to know that you offer that here for those who want to quit besides just pain, but there's other benefits to acupuncture.
Oh, yeah.
For sure.
Yeah, definitely. Okay, so shall we go ahead and take this out?
Sure. I have to say again that I don't even feel this at all.
Yeah, do you want to zoom in again? You surely can. It's very tiny.
Very tiny.
But you may, I don't know if you do you feel any sensation kind of going down this way?
I kind of did. While we were speaking, I could feel something going down my pointer finger here.
Yeah, and that's this point is called large intestine number 4. Okay, it's on the large intestine meridian, and the pathway of the meridian is going this way. And so many times that's what happens. A person will feel that energy begin to flow through their body. So let's go ahead and take that out. You can see there's no blood. And we are putting the needle right into a biohazard here. Okay, so.
Well, thank you for that.
Yeah, you're welcome. But it's neat. You could see it is not a painful process. And I think that's what stops a lot of people from trying it. They think it must hurt. And it really is pretty relaxing.
I'll have to vouch for that. That was very painless and exciting to see.
Thank you.
So I have a question. If somebody came in and they're having chiropractic treatment, and you're going to be doing other treatments besides acupuncture or chiropractic, how would that look? Do they start with what process before the others?
It kind of varies. Now, like I say, the chiropractor has been here about 16 years, so a lot of times he has become familiar with cases that are best treated with acupuncture. And so he might be doing a spinal adjustment, but they're also have a complaint that acupuncture would be helpful with. And he refers them, and so it's just convenient that they can see him either before or after. Now, if let's say it's pain related, and he's saying, hey, they're not holding the adjustment, can you loosen up the lumbar area? Often we would do the treatment before the chiropractic. They go into the chiropractic session, things are so much looser, and then the adjustment holds better. It just helps re-educate the muscles. So sometimes, I guess to answer your question, it can go either way. Sometimes they see him first and sometimes second. And with the massage therapy, same thing. You know, sometimes people get acupuncture and massage. We try to do it for their convenience. If a person's very tight or very uncomfortable, often the acupuncture is done first.
Okay. Oh, fantastic.
Mm-hmm. Yeah. And I guess one other thing, you know, that I could add is at this clinic we use a body cushion or body support system. So if a person lays face down, a lot of times when they get a massage at most places, you look at, if you're laying face down, you just kind of hang your head over with this little face cradle. And we have a really nice unit. Maybe we can pause and I could set it up so you could see how a person could lay face down, but it's ergonomic for the body. A person can lay totally straight, their neck isn't compromised, their shoulders aren't. Feel pinched down, and so most people lay on that and they're like, oh my gosh, I want to buy this for at home.
Take
you know,
it home with them. Yeah.
So I guess I should set that up maybe and show you that as well. It might be interesting
Sure.
for people to see.
So when somebody typically comes in for a treatment, do you stay in your clothing that you wear in, or do you change into a gown?
It depends what they're treated for. The quit smoking treatment, all they do is take their shoes and socks off because and they lay on their back. Those points are hands, feet, and ears, so we can totally get to those areas. A lot of sinus treatments are the same way. Now, if a person comes in and they have back or hip pain, sometimes they do need to undress the lower body. I mean, they keep their underwear on, but obviously their jeans and shoes and socks need to come off. So it kind of varies with the treatment. But do they have a gown? We have sheets, and they're totally covered. The area that we need to treat is exposed only.
Okay.
And to keep them warm, we use these are heat lamps. They're made in China. It's called a TDP lamp. And so you can see it just looks black, but it emits a frequency, and it's very good for pain. So it's a 2-for-1. We keep a person warm during the treatment, and also it really can help with pain. So these are in each room. We use them for massage and acupuncture. Very comfortable. No one gets cold with the treatment.
That looks like I like to take that home.
Yeah.
Yeah. All right, so should we take a look at that body?
Yeah.
Okay, Tina, can you tell me about the body cushion? How would this benefit one of your patients?
Okay, sure. So this is a cushion that we use if a person wants to lay face down or on their side, and there's so many benefits to it. I want to just point out a couple things. You can see that it follows the curve of the spine. So when a person lays on this, imagine you're laying face down. Of course, it's covered with a sheet. Your face is up here. There's a little bit of an indent for a breast recess. Can you see that indents a little bit for the abdominal area? There's cushions here that hold the pelvis up just a little bit. And then there's a bolster under the feet. So what happens if a person has to lay face down for a treatment, many times they're uncomfortable. They're already in pain. But when they lay on this for the treatment, because it supports the spine, takes pressure off the head and neck, they're comfortable. And they can lay that 25 minutes they need to in this position for acupuncture or massage therapy until they flip over. Just makes it a lot more comfortable. The face cradle is adjustable. It can go up and down. This can be replaced with one that's like this. So if you get a woman that is lactating or has any breast discomfort, this is used as well. When women come in that are pregnant, or maybe they can't even lay face down, I'll just show you that another way that this can be used is for a person laying on their side. This is covered with a sheet, with a pillow, and if you can imagine, a person lays facing her, with their shoulder in here, facing Maddie, takes all the pressure off the hip and the shoulder. So typically when a person comes for treatment, this is utilized probably in almost every treatment. Okay. Many clinics don't use this, but I'm telling you, it makes a big difference in feeling comfortable when you're having to lay still. Face cradle, of course, all of these are, sanitized. These are thrown away. With CDC right now and the COVID virus, we're taking every precaution that we can that's advised as far as, any handle, whether it's on the chair, where you'd put your feet, everything is sanitized in between each person. So someone could come and feel very safe about getting a treatment.
Very good. Very good. Yeah, we've all had to take extra precautions, and it's good to hear.
Yeah, it's important. Yeah.
So Tina, tell me what we're looking at here.
Okay, so the body support system that we were just talking about, if a person came in for a massage or an acupuncture treatment, this is what they would see. They would get undressed and lay right on that cushion, and they're covered with a sheet here. The environment in the rooms is such that once a person's getting their treatment, they don't want the bright light on their eyes, and so just giving you an idea, once the needles are placed so that they can relax or they get the massage, the lights can be adjusted. As you can see, they can go up and down. We also have a volume control on the music, so if someone wants it louder or they don't want any music or they want it quieter, we can accommodate them. So we try to have an environment that they feel very relaxed.
Soothing.
Yeah, very soothing. Absolutely.
Very nice. So how would somebody go about setting up an appointment with you? Would they contact their insurance company? Would they just call you?
Yeah.
What does that look like?
Well, all the appointments, when people come in for any service, it's all by appointment only, so they would need to call the office.
Okay.
And the receptionists are really good about walking them through appointment times and accommodating them. As far as insurance goes, most insurance companies do not cover acupuncture or massage. Some do. Some have to be referred by a doctor. So what we do for our patients is we have a receipt. They pay up front for the treatment when they come in, and then the receipt has billing codes, so if they want to try to turn it in for reimbursement, they can.
Okay.
It's like a super bill, but we do not bill insurance.
Sure.
And it's just because so many carriers don't cover. Most of them do not. We haven't found. Once in a while you get someone with a personal injury case, maybe they had a car accident. In those cases, often they do. But we still have them pay up front, they make an appointment. We don't really take walk-ins, because we go by an appointment basis.
There's certainly lots of benefits from acupuncture and massage that really can help a person live a fulfilling life.
Oh yeah, certainly.
Without pain.
Yeah, certainly. And this is a good time of year. A lot of people are thinking about what to give a loved one for Christmas. A massage makes a wonderful gift. We do have gift certificates and packages, with discounts for the holidays that aren't necessarily offered any other time of the year. So
that would be a great gift.
Yeah, just throwing that out there. Gives
Perfect.
people an idea to try something different,
I love it.
Yeah, thank you.
Well, I am so glad that we stopped by and spoke to you. How do we get a hold of you? Do you have a website?
I do. Right now my website is being redesigned, so if you go to that page, it may not look like it did even a month ago.
Okay.
But it is MTA for muscle therapy, and then the A is the word acupuncture, so it's kind of long. mtacupuncture.com is the website, and as I say, currently it's getting some updates. But I suppose the easiest thing would be if anyone wants information, we can mail, they can stop in. We have brochures that, for instance, are just about the quit smoking, or only about acupuncture, or cover the massage therapy or the cranial sacral therapy. A lot of people say, what's that about? And we have brochures on each one, so it's real helpful. If anyone wants some information, we can get it to them. But I suppose the easiest is just starting with a phone number. So we're at 483-7251.
7251 483. And you're located, what's your address?
It's 16648, right on US Highway 12 here in White Pigeon.
All right. Well, again, thank you so much for having us.
Yes.
I appreciate you taking the time to educate us on acupuncture especially. And any of our viewers out there, I will vouch that it was very painless, and I'm very glad that we stopped today.
Thanks, Lisa. I appreciate you both coming and helping people learn more about our services. Thank you.
Great.